I appreciate y'all having me today. I am a Republican candidate for governor. Of course, you're either a Republican or Democrat pretty much in the state. You're going to run on one of the two parties. Here in Alabama, what we need to do is create an environment by which we can entice new jobs into Alabama. The first thing we need to do is always keep Alabama a right-to-work state. That is the number one reason that we have been able to recruit jobs to Alabama in the last 15 years. Now, I have good friends that are in labor unions, and I am not talking about labor people. I'm not here to criticize people that are in labor unions. But you ought to have a freedom of choice whether or not you belong to a labor union or not. And that's what a right-to-work state is. And that's the reason we've been able to recruit Honda and Hyundai and Mercedes up in Tuscaloosa, where I'm from. That's why we've been able to recruit them to Alabama, is because we're a right-to-work state. Number two is we need to keep the cost of doing business low. And we've been able to do that in Alabama. We need to keep taxes low. And people say, well, y'all are the lowest tax state in the union, and we say, that's correct. We are. And we need to keep it that way. That entices companies to come here when we have low taxes. We have the lowest cost of energy of any state, or one of the lowest. So far. And that's why we need to oppose the American Clean Energy and Security Act, that one that's already passed the House and possibly could pass the Senate, part of which is called cap and trade. But that's not the worst part. The cap and trade is not the worst part. The worst part is having to use renewable energy, which we don't have in Alabama. That's the worst part of it. So we need to keep the cost of doing business low. That's the second thing. We need to continue to train well-trained workers, and we do that. I think we do that pretty well in Alabama through our two-year systems. We've had some problems in our two-year systems, but let me tell you, the federal courts have done a good job of cleaning that up. And our two-year systems are in fairly good shape right now. One of the things I want to do is I want to create an Office of Small Business Development. And I want to bring, we have these offices all over the state of Alabama in many of the major universities, but they don't connect and they don't correlate with each other. And so I'm not too sure how much good they really do. If we put an office under the governor's office that deals directly with that, teaches people how to open a business, especially a small business that creates 75% of the jobs, that's where we need to put our emphasis. We need to use our own tax system in order to create jobs for Alabama. And we do that by doing things like a bill I pre-filed week before last in the legislature that will give a company a 50% deduction of the income of an individual if they are presently on unemployment or their unemployment benefits have run out. So if you hire somebody off unemployment, you pay them $40,000 this next year. You got to keep them a year. You get a $20,000 tax deduction off your state income tax. Now people say, well, you'll never get that through because that's going to hurt the education appropriations. It's not true, because that person will go to work, pay taxes, and that will more than offset that deduction. That's how we need to do things in a state. We need to do it on a state level. Listen, folks, this is not something that just started with Obama and with his present administration.
No.
This started 70 years ago.
Yep.
And it's been a slow progression. And incrementalism is their mantra. See, they believe that you take a little and you take a little and you take a little and finally you're going to have everything. And that's what they're trying to do. If you have a system like they're trying to set up, what they're trying to do right now in the federal government is have a single-payer system in this country. And that single-payer system will be the federal government. And the federal government is going to control health care in America. And when it controls health care, folks, we're going to have rationing of care, and it's going to cost every person in this room more money. If you're 85 years old and you're in good health and you have an arrhythmia, but you still need a pacemaker, they're going to look down there and they're going to say, well, you're 85 years old, you're not going to get that pacemaker. And you don't think that's going to happen. It's going to happen. That's right. And to think that they're going to cut $500 billion out of Medicare, which is already too low as it is, because Medicare is not an entitlement program like Medicaid. Medicare actually was paid for by all of us. I know it wasn't a lot, but it was 1.45% of your salary every month that you paid into Medicare. And if they left Medicare alone, even though it still is a kind of a federal program, if you left it alone, it would have been fine. But now they're talking about cutting $500 billion out of that to help pay for this. Now, what is going to happen? Well, what's going to happen is there's not going to be enough money to pay for the elderly. That's what's going to happen. And then you're going to have doctors that are not going to take it.
Amen.
And if you don't have doctors that are not going to take it, what are you going to do? What should we have done? What we should have done is looked at a free enterprise way of handling health care. The best way to do that is to create health savings accounts. That's the way you need to go. That puts the patient back in control of their dollars. Now, those of us on Medicare, it doesn't matter. I'm talking about for young people. It puts the patient back in control of their dollars. You have to have a high deductible insurance policy associated with it, but they own their first $3,000, or if it's a family, it's $6,000. And if you don't spend that money, it's your money, and it rolls over year after year like an IRA. And it makes you decide if you want to spend $50 today in the family doctor's office, or if you want to spend $500 tonight in the emergency room for convenience. I'll guarantee you, what are you going to do? You're going to go to the family doctor. Because if you don't spend your money, it's your money. If we put our teachers and state employees on health savings accounts, and that's what I'm in favor of doing, we could save $100 million in our state government next year by doing that. And still give the teachers a raises and state employees, because if they don't spend the money, they get the money. We need simple electronic medical records that all doctors could interface their offices with, so that when you go into the office, that you won't have to have a multitude of tests that have just been done in somebody else's office. You ought to own your own health records, and you ought to carry it with you all the time. And you can do that very simply with a card, or you can do it with a zip drive. And when you come in to see me, now I'm retired now because I'm running full-time for government, but if you came in to see me, we plug that in. All your medical records come up, what you're allergic to, everything that's happened to you, and we know about you. That day when I see you, we add to your records and we give them back to you. Now, if you lose them, you just go to the last doctor you saw and they can download them again for you. But we ought to do that. We ought to also give doctors who will see indigent patients some tax credits. We do it for lawyers. And if doctors will see patients for free, let's give them a little tax credit. I'm not talking about a lot, but just something to help with them seeing these patients for free. We need to produce more primary care doctors in this state. I don't care how much insurance you have, and I don't care what Obama and the federal government come up with. If you don't have doctors to see you, like I've already said, it's not going to make any difference. What I want to do is set aside 25% of the seats in Alabama as primary care seats from the beginning. When you take that seat, you know you'll be an internist, a pediatrician, OBGYN, a general surgeon, or a family medicine doctor. Those are the 5. You'll be one of those. You'll have to make that decision by the 2nd year, and we're going to give those students $40,000 a year scholarship. But when they finish, they've got to give back to the state year for year in service, and we're going to call that the Alabama Health Service Corps. We're going to get 60 students out of that. We're going to get another 40 students out of a program that I helped start 4 years ago called the AMEC program, dealing with the osteopathic students in this state. And by the way, in 2012, it's either going to be private, public-private, or it's going to be public. We're going to have an osteopathic medical school, and it's going to be right here in Dothan. And that's going to produce 150 doctors a year. Now, talk about an economic engine. That's going to be an economic engine for this part of the state. Now, I've been working on this for the last 4 years. Now, this hasn't been announced yet, but I can tell you it's coming, and this is where it's going to be down in this area. And once we get it all worked out, that's what we're going to do.